Kamal, you are a psychiatrist.
I am, yes.
Tell me more about that. Where do you work?
Well, I've been a psychiatrist for over 30 years now.
30 years.
Longer
Wow.
than I care to remember.
Wow.
But I work at Monash Medical Center in Clayton. That is my public appointment. And my private practice is at Delmont
Wow.
Private Hospital in Glen Iris.
What inspires me is to see you coming along to a meeting to a launch where it's complementary medicine. So, may I have your thoughts about the book and the role of Vanita in assisting the patients?
Well, look, I have known Vanita for a very long time. We have collaborated
Wow. Yeah.
on many occasions. We've referred to each other, and my kind of philosophy about treating patients is that there's always room for all sorts of therapies and treatments, and there's things are different for different people, different patients, and it's not one size fits all.
Yes.
And so the sort of view that one particular model or one particular type of ethos will be right for everyone is too narrow, and we need to help our patients, our clients, in whatever way will work for them.
That's fabulous.
And so when
That's very inspiring to see
the approach that
approach.
the so-called alternative approach, I think complements the conventional allopathic type of approach, the medication, the pharmaceutical approach, very, very well. And in fact, my own view is that a lot of what we see, people with minor disorders actually don't need pharmacological medication. Okay?
And it's interesting because when I look at Vanita's book and her background, her book itself has a lot of scientific backup. It's evidence-based. So you had obviously an opportunity to read the
Absolutely.
book. And
Absolutely.
coming from a strong pharmaceutical background and a strong scientific background, I'm really curious about your thoughts about the book that Vanita just launched. One of the first books, it's going to be the first book to launch, and many more to come.
I think it's the culmination of many years of work.
Yes.
Vanita has been, thinking about and researching alternative therapies, nutrition, nutritional supplements, meditation, all sorts of different types of therapies for a very long time. And she has a scientific background herself, being a pharmacist. So she's taken a rigorous approach to validating treatments. It's something that she has, not just kind of picked out of the air. And I think that what she has put in this book is a very sound kind of scientific approach and philosophy to alternative treatments.
That's brilliant. My understanding that this is the first book, and there will be a few more coming up. I'm looking forward to see her writing some programs for practitioners as well, because as we know, the public wants a holistic approach, and ask the physicians, ask the GPs, ask the specialists, please, I want to have more education on that. So I'm really looking forward to see Vanita in the future stepping up and bringing that information to practitioners. What's your thought about that? Having practitioners reaching out for more information on complementary.
Well, I think I agree with you. I think this is the first of many.
Yeah.
And I think this book is going to gender a lot of interest from practitioners and patients and clients alike. And I think that it's actually going to, get people thinking a lot more. I mean, there is already a fair bit of, literature out there on complementary medicines, the holistic approach, alternative therapies, etc., etc. But this actually brings a very kind of scientific, rigorous kind of discipline to the subject, and I think that's the difference.
Lovely.
And I think it's going to spawn a lot of other material. I know that Vanita is thinking about doing workshops.
Yes.
She's already thinking about writing further. She's going to revise this one. So, it's all fabulous. It's all very good.
Kamal, thank you so much for coming here to talk to us, and I want to acknowledge you for having such a wonderful open mind to embrace new therapies for the improvement of the treatment of your patients, and I'm sure your patients will love your holistic approach as well.
Thank you very much
so
indeed.
much.
Thank you for asking me to talk to you.
Bye.